next important follow-up aspect is high-resolution ultrasound. So I just presented in Vancouver at our national aesthetic meeting. We have, as far as I know, the largest global experience evaluating breast implants with high-resolution ultrasound. We've ultrasounded about 20,000 breasts, again, in the last 25 years or so. And we have over 99% accuracy looking at implants inside the body. So what we do is we scan breast implants, particularly about every 3 years or so. We'll have patients come back in and just follow up with our own patients, but also we'll scan new implant patients back to the practice looking for breast revision. Super important to know if the implant's intact or not when you go into surgery, because you need to prepare for it. So with the current implants, I'm going to show you in just a second, they're really exceptional. Let's just look at one. So the new implants, hope you can see that here. We use an Allergan Naturel soft touch or highly cohesive silicone gummy bear implant. It's a 6th generation implant. Implants have been used since the 1960s or so. The important aspects of the new current implants are the older implants were underfilled and they created kind of a collapse of the shell that allowed the shell to rub on itself, and eventually, like steel can cut steel, silicone can cut silicone. So there's about a 1 to 2% deflation rate over time. The new implants are overfilled, so there's really no way that the implant can kind of impact on itself to actually cause a fold flaw or shell failure. The shells are incredibly strong, so they can handle about 6 million mammogram pressures. Also, I ran over some with my Ford F-150 a couple months ago. We posted that on Instagram a while ago, so you can check that video out. But the implant shells are incredibly strong. The next important factor we'll show you during the consult, you can actually cut the whole implant in half and all of the gel stays inside the shell. So the safety profile is much, much better. And I would say about 10-15% of first-time augmentation patients, particularly weight loss patients or patients looking for a larger implant or poor soft tissue, will use an internal bra of the material called Galaflex. And Galaflex is a natural protein, and it's a really cool kind of futuristic sort of product. It actually turns into your own body's collagen. And in patients for breast revision, it's really vital and useful for patients that need some sort of support or like an internal bra. So with Galaflex, this is just a 4x4. We're going to show you what the Galaflex looks like as well. But if you can just imagine, we put the Galaflex along the lower part of the breast. So it's the lower pole of the breast to kind of reinforce the soft tissue as an internal bra or sling. And so in patients that, again, have stretch deformities or malpositions after prior breast augmentation, or come in, a lot of weight loss patients, very kind of poor soft tissue, very stretchy skin, we'll consider using Galaflex at the immediate time of the revision. So those are some of the main factors that you need to think about. Getting proper informed consent, getting a good simulation where you can actually get involved with the selection of your implants, be able to visualize what that looks like, both with a breast lift as well as different implant sizes and position. Having very meticulous prospective hemostasis, that means no bleeding essentially during the creation of the pocket, perfectly fitting the implant, particularly the width of the implant, and then supporting the patient breast implants that need that with additional internal support, and then following up of the implants over time. We follow implants for life. With the new implants, we've not had a rupture. We've been using these for about 10 years now, but we can follow your implants long term. So That to me is where we are with the state-of-the-art breast augmentation today.